Do you want to have better control of your blood sugar levels or reach your A1C goal? By having a better understanding about diet, these goals can become a reality. Imagine you have two similar looking foods to choose from, but they largely differ in glycemic index. In being able to choose the lower GI food, you're less likely to experience a rapid or significant rise in blood sugar. As you make more informed diet choices, you'll be taking a big step forward in controlling harmful blood glucose spikes, diabetes, and potential complications from it. Thus, praise to you on being proactive so that you can take control in managing your blood sugar levels and overall health. In this video, let's focus our attention to diet and more specifically to vegetables. The veggies we'll go over can be considered as some of the best based on certain characteristics they have. These traits not only can help get you closer to getting your diabetes under control, but can offer other benefits. Let's now take a look at some characteristics, benefits, and examples. The first vegetable characteristic we'll take a look at is how little or how much starch it has. If unsure about starches, they are complex carbs that are broken down into glucose. By choosing the lower starch vegetable, you can expect a lower rise in your blood glucose after consuming it. Some examples of vegetables that are low in starch include cauliflower, broccoli, asparagus, bell pepper, and kale. Other examples include cucumber, spinach, and Brussels sprouts. The second vegetable characteristic we'll shine light on is the amount of fiber it has. By opting for a vegetable that is high in fiber, digestion will typically take longer. This can lead to both a feeling of fullness for longer and a slower increase in blood glucose. Some examples of veggies that are high in fiber include cabbage, carrots, artichokes, Brussels sprouts, and spinach. Other examples include broccoli, green peas, and collard greens. The third vegetable characteristic we'll focus on is its glycemic index. As hinted to earlier, glycemic index of a food refers to how quickly or significantly blood glucose rises after eating that food. By selecting a lower GI vegetable, you can anticipate more of a subtle change in your blood sugar after eating that vegetable. Some examples include cauliflower, cabbage, eggplant, zucchini, and kale. Other examples include Brussels sprouts, mushrooms, and green beans. You may notice most veggies that are low in starch have a low glycemic index as well. The fourth characteristic we consider is whether a vegetable is processed or not. One way veggies are processed is by having added sugars. An example that you may have eaten in the past is canned corn that is sweetened. Choosing the non-processed version of corn will allow you to avoid those excess sugars. A second way of processing is by the addition of salt. The sodium alters both the flavor and extends the shelf life of the veggie. However, too much salt can worsen blood pressure, swelling, and heart failure, to name a few. The fifth characteristic we'll shine light on is if the vegetable interacts with medications. One example is leafy greens, which are high in vitamin K. These can interact with the blood-thinning medication called Coumadin or warfarin. This interaction can lead to a decrease in its ability to thin the blood and therefore its effectiveness. Other interactions exist that are based on the effect of the veggie itself. For instance, among various properties, garlic has a blood-thinning effect. Combining garlic with Coumadin or other blood thinners like aspirin and Plavix may lead to additive effects. These additive effects can be dangerous. Another example are avocados. Although these are technically fruits, avocados are considered a good source of potassium. However, they can lead to higher than normal levels of potassium in those with kidney disease. So interactions come in different shapes and sizes, resulting in decreased or increased outcomes. As we've broken down several important characteristics, It's worth pointing out that this list is not all-inclusive. Also, there are other vegetables not mentioned that can be considered as best. Nevertheless, what we've covered can serve as a starting point to further build your knowledge when it comes to making better veggie choices for improved blood glucose management. Resources like dietitians, diabetes educators, and endocrinologists can help further increase the likelihood of glycemic control and success. As always, I hope this content serves you well. If you found this valuable, please click like and subscribe. I will see you guys in the next video.